take a moment to think about what we have all undergone over the last 2 years. Health has taken paramount importance. While we are all professionals of the wealth, health is even more important. The next speaker is going to embody this spirit. We have Ayurveda, the holistic approach to wellness, a talk by Dr. S. Bharath Narendra. Dr. Bharath Narendra is the MD of Bharath Clinic. He was the former HOD of Sri Jayendra Saraswati College and Hospital, Medical College and Hospital, and he has over 50 papers and conferences that he has been part of earlier. He's an expert in Ayurveda and he provides novel ways to treat his patients using Panchkarma treatment. And he mentors students as far away as South California University as well. Over to Dr. Bharath to give us a holistic approach to wellness, the Ayurveda way.
A very good evening to one and all who are attending this seminar. I thank IFA Galaxy for this opportunity. I am Dr. S. Bharath Narendra. My topic is Ayurveda, holistic approach to wellness. Ayurveda is an ocean. In the given time, we cannot do much justice to the whole of Ayurveda. So, we will be seeing one small part of it, maybe a drop of it. Dear friends, did you all know that in the whole world, in every second person's household, there is going to be at least one major surgery? I am not saying this, WHO is saying this. In 2004, with the available data of around 30% of the members of WHO, it's saying that there were about 6 lakhs major surgeries conducted every single day all over the world. And this is, mind you, with the available data of 30% of the member countries. So, if you can multiply it by 3, it's around 18 lakhs to 19 lakhs surgeries, major surgical procedures every single day, and this is in 2004. Today, in 2022, it's doubled since, which means which was around 234 million major surgeries in 2004, today is somewhere around 460 million surgeries in a given year. And the minor surgeries are around 10 times more than this. In 2018 alone, one single organization, that is the New Delhi AIIMS, conducted more than 1.94 lakhs surgeries. Friends, we all have lost something to this COVID. Some may have lost their dear ones, some may have lost their friends, some may have lost their business, some have lost their precious time. But there is one thing that has not lost to COVID, and that one thing, COVID has lost its battle. It is the number of surgeries. Even in India, even during this pandemic, in 2020, a mere 500,000 surgeries were only cancelled because of COVID. Imagine conducting 18 lakh surgeries in a day all over the world, and in a whole year, only 500,000 surgeries, around 580,000 surgeries being cancelled because of COVID. So, I am here to tell you how Ayurveda can help you to avoid some of the surgeries that can be conducted. For example, let us start with disc prolapse. Whenever a person has a neck pain or a back pain which becomes suddenly very severe, most of the people ignore this initially. They say, I have worked out a lot, or I have traveled a lot, or I have been sitting for long before my computer. I mean, most of us sit for at least 6 to 8 hours before our computers, right, per day. And we start getting a backache, and then we take all kinds of comedy postures, and we start walking with the pain, we start living with the pain. This is where we do the mistake. We approach the doctor only when it is very severe. The disc prolapse cases, for example, I will give you one of the cases that was treated recently with Ayurveda. A 36-year-old man with a severe fall injury on January 16th. It was a Sunday, and because of this injury, he was not able to walk, he was not able to sit. Handsome of a guy, he was looking like Hrithik Roshan with a good beard and like another Greek god and something like that. You all must be worrying why this guy is talking about this guy's looks when he has to talk about the back pain, because the guy is me. I would like to think myself as Hrithik Roshan. Hopefully Hrithik Roshan is not watching this today. If he is, I am really sorry. So, coming back to the issue, because of this back pain, in 1 week I had to attend my mother's ceremony, where I had to sit on the ground for almost 3 hours the very next Sunday. So, I went to a good friend of mine, I went to an allopathic doctor, I wanted a second opinion. Everybody wants a second opinion, even I went for a second opinion. And he said I need to take 3 weeks to 6 weeks of bed rest along with his medicines, which was not possible for me. So, like how I helped all my other patients in this long career, I have also tried Ayurveda on myself. I underwent Panchkarma therapies for about 6 days along with internal medications, and on the 7th day, thank God, with God's will, I was able to sit on the ground for 3 hours and conduct the ceremony properly. So, this is the magic of Ayurveda. It was a disc prolapse where if I would have gone for a surgery, I would have been rendered with bed rest for about 6 to 8 weeks. The pain, the amount of money I would have spent, the amount of business I would have lost would have been manifold when compared to the 6 days of Panchakarma that I did. Next, we can take knee problem, for example. Recently, we treated a 60-year-old female who had a severe knee joint pain. She was not able to walk, she was not able to climb stairs in her own house, and she came to us and we took an MRI. This MRI showed that cartilage in her knee joint, in her right knee joint, was lost, almost completely lost, that it was not even visible properly in the MRI scan. Cartilage is something which holds the bones together, and if it does not hold the bones together, then the bones start scratching over each other and the degeneration process is very fast. We again started internal medicines for her, and we also gave a lot of Panchkarma therapy. Thanks to God that she came to Ayurveda, and within a span of 3 months, my dear friends, she started walking. She is now doing all her daily chores and she is able to climb stairs in her house. If she would have gone for a surgery, it would have taken almost 2 to 4 months easily, given her 60 years of age, for her to recuperate from one surgery. So immediately after the first surgery, she would have been advised the second one, and she would have been rendered again with bed rest for about another 4 months, which is totally 8 months. So her productive time we have definitely saved for her, and the cost is also not even 1/3 or half of what she would have spent for the surgeries. We are not against surgeries here, but we are trying to give an alternative. We are trying to let people know that Ayurveda can help in these conditions. Not only surgery is the only solution, Ayurveda can be a great solution for you. For example, let us take another story of a 36-year-old female. She was working as a teacher. She came to us with multiple gallbladder stones in her gallbladder. She had small stones, about 5 to 7 millimeters stones, and funny, a small thing like a 7 millimeter stone can give such an amount of excruciating pain. And she came to us, and mind you, she was referred by an allopathic doctor. The allopathic doctor who took the scan for her told her there is only surgery here available, you can try some alternative solution, and an alternative solution can be Ayurveda. And she came to Ayurveda and we were able to help her. After about 1 year's treatment, and we took a checkpoint, we took a scan every 3 months once, and after about 1 year of treatment, she was completely relieved of all these multiple gallbladder stones. Gallbladder is the organ which helps you to create bile so that you will be able to digest your food properly. If that is cut, even if the surgery is done, lifelong there will be a problem in digesting food. But what we have done is, we have not only saved her money, we have not only saved her time, like I told before, we have given her a quality of life and we have cured her without surgeries. Another example, varicose veins. Many people will be suffering with this. People especially who are standing for their work continuously for hours together have some knotty green colored or blue colored knots in their legs where the vein loses its capacity, it loses the valve's capacity to push the blood back to the heart. When this happens, there is a lot of leg pain and all that associated with this, and there is also a pressure on the circulatory system. And when this happens in a man, it can even happen in places like the testicles, which is called as the varicocele. This is not a treatable condition in many medical systems, but with Ayurveda, for example, in a 30-year-old male who came from Dubai, he came for infertility. He did not have a good quality of sperm. He came to us and we treated his varicocele first. He was given 3 months of medicine first. He was having grade 4 varicocele and we treated him for 3 months, after which we took a scan, and from grade 4 it came back to grade 1. So by choosing Ayurveda, he not only chose a healthy life, but he also avoided a surgery. Again, after 3 months of medication, he is now completely relieved of the varicocele he had, and now, thank God, his wife is now carrying, they are going to have a very healthy child very soon. So these are some of the examples. Other than this, as we are talking about men now, we are talking about varicocele now. There are other complaints also that middle-aged men face. For example, BPH, benign prostatic hypertrophy. There is a gland called as prostate gland in your body which gets swollen with age. Going to the loo will become so difficult and they have to go and wait. They have a lot of problems. Men have a lot of problems when this benign prostatic hypertrophy happens. The only solution given to them is surgery. But with Ayurveda, they can undergo some Panchkarma therapies, which is called as Uttaravasti, where the medicine is directly given through the genital tract and also oral medicines are given through the mouth. For each person, it may take 3 months or 6 months or 1 year or whatever that is, but they can avoid this surgery. As we are talking about men, we will talk about one more surgery. It's called as Teza. Whenever I hear this word Teza, I remember my MD times. When I went to Bijapur, I had a Marathi Masi who used to make me chapatis and one excellent side dish called Teza, where green chilies were pounded along with garlic and a little bit of salt was added. That was my side dish for chapati. By the time I finished my MD, this was one of my favorite dishes. Why I am trying to say this is, it is very, very pungent. It is not very easy to digest Teza, Marathi Teza. The same way for a man to undergo this Teza surgery, TESA or testicular sperm aspiration, basically they will insert a needle, they will drill a needle into the testicle of the man and they will take the sperm out for IVF or ICSI, for artificially creating a baby. And it might be fruitful or it might not be fruitful. Poor guy, we can only imagine what he will be going through whenever he sees some drilling equipment. So on a lighter note that was. So coming to a more serious note, cardiac health. Most of us are worried about our cardiac health. We do a lot of cardio, we do a lot of exercises, we take medicines day in and day out, but most of them who take a lot of care about their cardiac health still undergo angiography. When you go to the doctor, when the cardiologist is going to write an ECG or an echocardiogram or an angioplasty or an angiogram, even when you do not have a heart problem, your heart starts pounding and you feel like you are going to get a heart attack, especially when they are taking those tests. But with Ayurveda, there is preventive care available. There is also curative care available when there are heart blocks. I am a great fan of Dr. B.M. Hegde, who is a cardiologist and supports Ayurveda greatly. And he says most of the heart surgeries can be avoided. And I am one of his followers and I do the same thing. So Ayurveda will take care of you if you take care of yourself with Ayurveda. The next thing is, one of the most commonest surgeries that we all have seen our father, our grandfather, our grandmother undergoing is the eye surgery for cataract. One day, my dear friends, one of the persons who was supplying medicines to me, he came and told me, "Oh, you have these 2 eye drops with you? I use this on a daily basis." So I asked him, "For what you use this?" You can get gyan from anybody at any time. You just have to be receptive. And this person was only selling medicines, but he gave me that gyan that day. I was using those eye drops for something else, but he said, I was having a very matured cataract and I started using these 2 eye drops. After a span of 2 to 3 weeks, I was able to see properly. He was advised by a big hospital to undergo cataract surgery within a week. And the doctor suggested him this, and he started using it for 3 weeks, 3 times a day, and his vision was getting better. Because he saw some visible difference, he continued this for 6 months according to the doctor's prescription. And then he went back to the same hospital, which told him that he has to undergo the cataract surgery. And they said, your cataract is reduced, you can come after 6 months. Again, he used the same medicine for 6 months, no internal medication, only eye drops. After 6 months, when he went back to the same hospital, they said, you are relieved completely of cataract and you can be happy, you don't have to come back for the surgery. This is the power of Ayurveda, my dear friends. Some people call Ayurveda slow. What is slow? It is a very relative term. Is doing a surgery and curing the person in 2 minutes or 5 minutes or 1 year or 1 day, whatever that it takes. For example, the knee surgery we were talking about before takes 8 months to recuperate, right? Curing a cataract without any medication, orally, only with eye drops, although it takes 1 year. Now, I leave to your prerogative whether this is faster or that is faster. Each one has their own perceptions, each one has their own discretion, you can decide. We also have talked about men, so we will now talk a little bit about women. Cesarean sections. One of the cases we faced, the lady was a 23-year-old lady. She was carrying 5 months. That is, she was pregnant for 5 months. Because of a very unfortunate incident, at around 60 kilometer speed, she fell on the road and she rolled. Immediately, she went to her doctor scanned her and they said, luckily you are very fine, go home, take rest for 3-4 days, go start doing your work again. Thank God the husband and wife went home back, but after just 3 weeks when they went for their regular checkup, the same doctor told her, your uterus has started to open from the inside and you may deliver the child very soon and the child may or may not be alive. This was one option given to the mother. The second option given to the mother was they will do a cervical encirclage. Basically, they will stitch the uterus mouth and because of this, the child will not fall down. Even if they stitch, she has to be on full bed rest for the next 4 months and they will be giving some hormone tablets which may or may not affect the child's brain. Imagine the mother's agony. After the encirclage, they came to us and we stopped all the medicines that they were taking. We put her on basti. Basti is one of the Panchakarma techniques that we use. Basti is like enema. The rectum is used for giving medicines. I think you all know what is enema. Other than that, some oral medications were also given. She was on full bed rest, but this hormone medicines were stopped so that the child is perfectly okay. And after 4 months, she went to the same doctor and the doctor said, your encirclage is completely okay, your baby is also completely okay. Now we will remove the encirclage with a small procedure. And she delivered normally the child. None of the children, according to statistics, are born normally through a normal delivery when cervical encirclage is done. Most probably it is cesarean section. Now she avoided a cesarean section, but when she became pregnant for the second time, she went to the same doctor again and they said, even though you have no problem, you should go for the same cervical encirclage again. She came back running to Ayurveda and we were happy that we were able to help her. We again started basti, but this time no bed rest, because when something is not broken, we don't try to fix it. We gave basti for the next 6 months, 7 months, almost 8 days every month. And internal medicines were also given. And she went for her final scan in the 9th month to the same doctor, and they said, you are completely fine. You can deliver your baby normally. And she went for her normal delivery for her second child also. So we have avoided almost 3 surgeries in her, 2 cesarean sections and 1 encirclage. This is the power of Ayurveda, my dear friends. We also help ladies to avoid hysterectomy, cutting of the uterus. When there is uterine fibroids, too much of bleeding, any problem for that matter of fact, our sincere advice is don't go for the hysterectomy operation unless and until it is ultimately necessary. Go for a second opinion, like, I went to another doctor to know what it is. Go to an Ayurvedic doctor, just consult them once, ask them whether this is possible or not. There are also other operations like laparoscopy operations done to young women who are having PCOD, adenomyosis, endometriosis. These are all problems of the ovaries, of the uterus, where a laparoscopic surgery, keyhole surgery, small holes are done and the surgery is done through that. They don't cut open much, but still a surgery is a surgery. PCOD and all these things like adenomyosis and endometriosis, we give internal medications and we give one simple pichu. Pichu meaning soaking a good sterile cotton in the medicine that we are giving and inserting it into the genital tract. And when they do this continuously for some months, they can avoid this surgery, they can be free of PCOD, they can also be free of adenomyosis and endometriosis. Let us see some more 1 or 2 conditions where commonly people go for sinusitis. When you have continuous sinusitis, headache, there are some nasal polyps, there are some small growths inside the nose, and people undergo surgery for this. This surgery's shelf life, if I may call it, is somewhere around 2 to 5 years. Imagine for your sinusitis and your nasal block, which makes you sneeze 20 to 30 times in a day, especially when you get up early in the morning. If you go for a surgery when you are in your 20s, let us imagine you are alive till 70, and even if this surgery helps you for 5 years, 20, 25, 30, 35, 40, 45, 50, 55, 60, 65, 70, 75, they have to undergo this surgery for 7, 8 times in their life for one single problem. But this can be avoided with Ayurveda, again with Panchakarma and internal medicines. Here Panchakarma will be putting medicines through the nose, giving medicines through the nasal cavity. It is called as Nasyam. Other than this, we will also give some internal medications, some steaming medicines and all that, which will reduce the swelling which is there inside the nose. And the sinusitis is also cured, which is the root cause of these nasal polyps, and the nasal polyps, that is growths inside the nose, are also cured. Again, they will have to get treated for 6 months or 1 year or something like that, depending upon each person. And they have to adhere to the diet chart, they have to adhere to the exercising charts that we give. For example, what exercise can you do for your nose? You can do Jalaneti. You can use warm water with salt and you can do a nasal irrigation. The doctor can teach you that. Other than that, you can do pranayamam, which will reduce the inflammation inside your nose. It will also increase the oxygen availability in the whole body and also to the brain. So some added good side effects are also there, no bad side effects in the things that we give. One more very, very important case was in a 2-year-old child. She came to us with rickets where her legs were bowed legs were there. Below the knee, her legs were bowed. And the parents were in great anguish, and when they went to a pediatrician during the COVID times, imagine the amount of tension they would have had taking the child out and taking her to the pediatrician. The pediatrician saw her and she said, let us try and treat, but after some time she has told that you have to go to a pediatric surgeon. Before going to the pediatric surgeon, luckily these people came to us and we gave Basti again. Basti is the transrectal route enema therapy for this child. And now when they went to the surgeon said, after seeing the x-rays of before and after x-rays, he said this surgery is definitely avoided. Yes, the rickets will take time to heal. It will take another 1 or 2 years to heal, but we avoided a surgery in a 2-year-old child. This is the power of Ayurveda, my dear friends. So, other than this, how can Ayurveda help you? Friends, I'm going to give you 3 things that you can do after you go home. Number 1, like how you maintain your vehicle or any machinery, go to an Ayurvedic doctor at least yearly once or 2 years once or 6 months once will be actually better. If you can go, like how you maintain your vehicle, they will be able to give you specific cleansing procedures for each and every one of you according to your prakriti, your constitution, your bodily constitution, your mental constitution. According to that, they will be able to give you specific cleansing therapies. You can undergo them once in 6 months, once in a year, and so on and so forth. And you can also avoid many of the surgeries that I was talking about right now. Number 2, please come to us as early as possible. Don't come to us very late. Most of paralytic attack cases come to us very late. This has nothing to do with surgeries, but paralytic attacks can be cured very, very, very fast if you come in the first 15 days to Ayurveda. We also give a lot of targeted exercises which will help you, like how I told, even for the nose we have exercises, for the back we have exercises, for the knee we have exercises, along with the Panchakarma therapies and the medicines that we give. So this will help you to adhere to a very healthy lifestyle, and these small changes in your life will make you happy and very, very healthy, and to live the Ayurveda way. Thank you one and all for giving me this opportunity. Have a good day.